talk about testing now, Dr. Hilary, because the government says its testing system will be the guiding star in its fight against coronavirus. The Health Secretary said a new rapid test could change the way we control COVID-19 across the country. So let's talk now in more detail about this testing. I mean, Dr. Hilary, they're talking in the papers today about it being a game-changing situation. So how much of a difference is this going to make?
Well, they're trialling this new 20-minute test. It's called the LAMP test, which stands for lamp-induced isothermal amplification. Easy for me to say. What it means is they can do it on site. They don't have to wait to send a sample off to the laboratory and wait 3 or 4 days to get the results back. Results back in 20 minutes. And it's sent to be, we think it's going to be very accurate. And that will be a game changer in that it will tell people whether they haven't got the virus and they can carry on working and seeing patients, and whether they have, in which case they'll need to self-isolate. But they'll be able to tell those people very quickly. So they'll be trialling this in A&E departments, amongst the North Hampshire NHS Trust hospitals, where they're going to see 4,000 people over all age groups to do this. They'll be trialling this in prioritised care homes and in the GP hubs that are doing the testing. So it's going to be a really important trial, and it could be a game changer.
One thing we were talking about, Dr. Hilary, because later on today, we understand Priti Patel is also going to announce these plans for a quarantine. So anybody coming into the country is going to have to self-isolate for 2 weeks. When these tests get up and running, these 20-minute swab tests, would they not be available to be able to test people at airports, for example, before they then let them go? That they'd be able to say, right, 20 minutes later, you're good to go because you've got the negative test? Would
that were the case? I really wish that were the case, but I'm afraid it isn't, because you'd have to be symptomatic for this test to be positive, even if it is successful in trials. So somebody coming into the country, they're not symptomatic, test isn't going to be positive, it doesn't help. They'll still have to go through that 14-day period of self-isolation and quarantine in order to preserve everybody's safety and their own. So this won't actually change that. And I know that's not what the aviation industry wants to hear. But when you screen people, when they're asymptomatic, they don't have a temperature, this test might not be positive, and therefore it's not reliable.
Are you as confident and as sort of hopeful as Matt Hancock is? He's saying these faster antigen tests have the potential to change the way people are treated.
Yeah, if they're accurate, if they're as accurate as the PCR test, which has been used up to now, which is the nose and throat swab, which is then sent off to a laboratory and analysed, if it's as accurate as that, then it really will be a game changer, and we can isolate people much more quickly, and that will help to prevent the transmission of the virus. As regards to the antibody tests, which the government's saying they've ordered 10 million, this is potentially a game changer as well, because it will tell people whether they've been exposed to the virus already and that they've got some antibodies present in a blood sample. What it doesn't tell people is whether they could be reinfected, because we don't know that yet, and it won't tell people if they've got some antibodies, whether that gives them lasting immunity. This is a new virus, so we just have to wait and see whether that's the case by retesting over serial tests over several months.
But, Hilary, it's interesting, isn't it, this idea that you could have a certificate, so you could have an antibody test, and then if that shows that you do have the antibodies present, you could have a certificate to prove that, which could mean that you don't have to be socially distant?
Difficult one, this, controversial. A certificate of immunity, we don't know how long immunity lasts. Secondly, those certificates could be forged for people to go back to work when they've potentially they could be infected. I think there are difficulties. There could be discrimination, whether you've got a certificate or not, so employment implications as well. So I think we have to wait and see on that one.